Good morning. I'm great.
All right, what are we talking about today?
Well, continuing our November series on Diabetes Awareness Month, and you only have one more day to be aware of diabetes, so better get with it. We're
Well,
talking about prevention. We're talking about prevention of diabetes and if medications can help. There's drugs for every occasion, so thought
yeah.
we'd talk about drugs today.
Well, let's talk about that because obviously you work with so many, not only in your practice but also in the research too. What sort of the categories or what do they fall under diabetes medications?
Well, we were talking about preventing diabetes, and we've talked about how diet can prevent diabetes and exercise. There's no drug that makes you exercise unless you want
No.
to get to it and you have to run to it. And I usually tell people this drug works better if you walk every day. So take it after you've walked for an hour,
I
and it
like
works
that.
even
I like
better.
that idea.
But there's a couple of categories. One is just diet medications, like medications that make you lose weight, which are not very good, but I mean, there are some like that. There's phentermine, which increases your metabolic rate, but your body adapts to it and only works for a couple of months and then it's gone, quits working.
Mm-hmm.
There's other more expensive ones, Contrave and Velvic, which are approved by the FDA for weight loss. They mostly work on your brain and tell your brain not to eat, which most people don't pay any attention to their brain anyway. So that's that may not work very well. There's Qsymia, which is a phentermine Topamax combo. So Topamax is a drug that's used for chronic migraines, and was a seizure medicine, but it's not very good for that. But that makes your taste buds change, so nothing tastes good. So Topamax is used for weight loss also. So that's one group of drugs that can be used to help you lose weight so that you don't get diabetes. And that's
Mm.
always crucial to lose the abdominal fat.
Now, have you seen patients that have had successes with any of those?
Yes, I mean, mainly we use phentermine, but it's only a temporary thing because if you don't correct the underlying genetic defect, which causes the diabetes eventually, just losing weight may not help. You may not lose weight permanently, and what you'd like to do is lose weight permanently and correct a genetic defect. And most people don't realize that. I mean, it's still there; it's programmed into their body to gain abdominal fat. So if you don't do something about it
Mm-hmm.
permanently, and I'm not sure there's anything you can do except be a marathon runner. You could do that. Most people don't choose that course, but there's not. They say, well, I'm going to lose this weight and keep it off. Well, it's hard to keep it off, and studies have shown that it's really hard to keep it off. And the only way to keep it off is to exercise. So if you don't use medications, then you're going to need to exercise, do something every day, be more active, and of course cut back on your food. So if you don't use any medications, you might could do that. But most people are not able to do that, and we're stuck with there's genetic defects here that cause them to eat more. There's genetic defects that cause low blood sugars, they make you make more insulin than normal because you're insulin resistant. So that's the other group of medications. They're actually diabetes medications, but they work before you get diabetes. So metformin is a typical example that American Diabetes Association even recommends using metformin if you have pre-diabetes. So
Mm.
pre-diabetes we talked about uh, can lead to diabetes, but it helps insulin resistance. So if you're insulin resistant, you make too much insulin because your body can't use insulin properly, then insulin makes you gain weight in the middle. And if you treat the insulin resistance with metformin, then theoretically you're not going to gain all that weight in the middle and hopefully prevent getting diabetes wearing out your pancreas.
So once again, I mean, we talk about weight loss a lot about how those things, but I guess it goes back to Doctor the if you are at a risk and you assess all these different risks, both genetic and physical appearance, all those things, risk for diabetes, then you probably ought to be monitoring and consulting with your doctor on a regular occasion about should I be taking any of these things to prevent it.
Yes, and I don't think a lot of doctors really treat before diabetes. I mean, I think the trend is to do that now because we have drugs that really help prevent diabetes. But in the past, we haven't been we wait till a person gets diabetes. And by the time you get diabetes, half your ability to make insulin is gone forever. So you'd really rather protect your pancreas by doing something for it, before. What's interesting is there's a drug called Victoza that was approved for diabetes in 2009, and now it's a weight loss drug. So it's got a new name and twice as expensive, but it's called Saxenda, but it's a higher dose of Victoza. And so somewhere along the way, this overlap between weight loss drugs and diabetes drugs is very interesting, that they take a drug like Victoza, which makes you not hungry, but it also prevents your sugar from going up and down. It helps insulin resistance, and they made it into a weight loss drug. So there is an overlap there. However, if you want to get Saxenda, you have to put that it's for weight loss. It's not for diabetes. So if you actually put the person has diabetes, the insurance won't approve it, but they'll approve it for weight loss sometimes.
Interesting. So is this something that is this one of those drugs that you were part of testing as well?
Yes, we used Saxenda. It's just a higher dose of Victoza. Victoza goes up to a certain milligram, 1.8 milligrams, and Saxenda goes to 3 milligrams. And they used it in people with diabetes also that needed to lose weight, and they used it in people that didn't have diabetes. But it helps everybody because it makes you not hungry. It makes you feel full all the time. So that's an interesting way of approaching it, especially since a lot of the people that are overweight now may end up with diabetes. So it sort of treats two things at once, and it's a very interesting concept.
Okay, all right. We'll take a short break. We'll come back in just a moment with Dr. K.G. Lucas from Diabetes Endocrinology Consultants. And Dr. Lucas, when we're talking about whether or not medications, you mentioned before that doctors are kind of reluctant to talk about or to deal with this before the diagnosis of diabetes. So is it up to me to bring it up?
I think so, and I think more and more doctors are using these medications. There's some problems with insurance plans covering them if you don't have diabetes, the ones that are diabetes drugs, and you hate to wait till somebody gets diabetes to treat them. So metformin in general is well accepted and it's cheap, and if you had to buy it yourself, it's not a big deal. Some of these other ones are pretty, and phentermine, which is the diet pill, is real cheap, but the other ones are pretty expensive. So weight loss drugs in general are usually approved by the insurance plan now. It used to be that they wouldn't approve diet medications. So for sure metformin if you're insulin resistant. If you're severely insulin resistant and you need something else, that's when you think about these other medications. Like if the metformin's not really helping or your insulin level's not coming down, we see that in severe insulin resistance, and you may need another medications for that. So if you've done diet and exercise and you're doing really well with that, you don't necessarily need a medication if your problem is mild and you're not that overweight. And of course, we didn't talk about weight loss surgery, but that's certainly an option. That's not under the medication category.
Right.
But if you're also extremely hungry all the time, if all you can think about is food, and there's a lot of people like that, and they think that's just the way they are, but it could be because if you make a lot of insulin, you're always thinking about food. Insulin wants food, wants you to eat, especially carbohydrates, especially sweets and starches. So if you're like that, especially children that are hungry all the time, because it's unusual for a child, and a child gaining weight in the middle, maybe insulin resistant. So we always want to keep an eye out on that, because the earlier you treat somebody for a severe insulin resistant problem, the better off you are.
All right. If you want to find out more, you go online at beachdoctor.com and always find out more about what's going on with the latest in diabetes research, too, from Diabetes Endocrinology Consultants. Beachdoctor.com. We'll see